My grandfather was a doctor for over 5 decades. Today, at 88, he still carries an energy that impresses anyone. I remember him in the office, always dressed in his impeccable white coat, examining each patient with incredible patience, even on the most tiring days. He had a mantra that never left my mind. Small symptoms are never that small. This phrase shaped my decision to pursue medicine. And now, with my own experience, I can confirm that he was right. I'm Dr. Ana Laura, and I want to share with you a topic that could transform your outlook on health: itching, a symptom so common that many associate it with simple things like dry skin, allergies, or even aging, can hide something much more serious than we imagine. My grandfather used to say that the body is a persistent messenger. When the itch appears persistently, doesn't go away with basic creams, and seems unexplainable, it's a sign that something deeper is going on. I've experienced this in my clinical routine and also learned from listening to his stories. One incident stuck in my mind. A 76-year-old man, whom I'll call Mr. Manuel, arrived at the doctor's office in despair. Every night, right after his shower, he felt an unbearable itch on his lower legs. He'd tried everything: moisturizing creams, home remedies, even warm compresses, but nothing helped. The strangest thing was the timing. Around 3 a.m., the itch worsened dramatically. His worried wife accompanied him in his search for an answer. When I examined his skin, I found nothing obvious. No lesions, nothing to explain the discomfort. That's when I remembered what my grandfather had said and decided to order more detailed tests. The diagnosis surprised everyone: early lymphoma. Manuel looked at me wearily and said something that touched me deeply. I thought it was just because I was getting old. How many people, especially the elderly, ignore symptoms, thinking it's all just a matter of getting older? The truth is, science has shown otherwise. Study after study, with over 50 years of medical data, reveals that many people who developed cancer experience persistent itching months before diagnosis. This is no coincidence. So today, I want to talk about 6 areas of the body where itching can be a warning sign of different types of cancer. I'll also teach you 5 simple steps you can take at home to differentiate between a common itch and one that warrants a visit to the doctor. This information is especially important for those over 60 or caring for someone in that age group. Knowing how to spot these signs can be the difference between an early diagnosis and a much more difficult battle. I invite you to stay with me until the end, because what I'm about to tell you could save your life or the life of someone you love. It's not about living in fear, but about being mindful, learning to listen to what your body has to say. As my grandfather always said, medicine goes beyond prescriptions and hospitals. It's in our ability to observe and act in time. Let's start with the first risk zone, the calf. Pay attention, because this is one place where a seemingly minor itch can hide something very serious. When an elderly person experiences constant itching on the front of their legs, especially during the early morning or evening, they need to be vigilant. It's not just dryness. In the clinic, it's common for people to initially think the problem is circulatory problems, poor hygiene, or simply dry skin. But the story isn't always that simple. I remember Mr. Esteban well, a 75-year-old man I recently treated. For 3 months, he endured a terrible itch on his lower legs, which would wake him up religiously at 3 a.m. At first, he didn't pay much attention. He applied moisturizing ointment several times a day, hoping for relief. When that didn't work, he tried hot massages, compression stockings, and even expensive lotions his wife bought to help. Nothing worked. The itch only worsened, and he ended up exhausted. When I examined him, I found no visible lesions on his skin, no redness, eczema, or spots. The curious thing was that the itching worsened as soon as he lay down, precisely when he should be resting. During the day, when he moved around, it seemed to improve, but at night, it returned in full force. This detail, which may seem small, was what alerted me. Lymphoma, a type of cancer that attacks the lymphatic system, often manifests itself in exactly this way: intense itching at night that doesn't respond to standard treatments. The lymphatic system, which is responsible for filtering and supporting our defenses, when inflamed, releases substances that activate peripheral nerves. This creates the itching sensation, even when the skin shows nothing visible. It's a silent internal signal that something isn't right. To help you differentiate at home whether itching is just a common annoyance or something that deserves attention, I always recommend a simple test. Use a good moisturizer or a lotion specifically for itching at least 2 or 3 times a day for a week. If it's a common skin problem, such as dryness or dermatitis, relief usually appears quickly. But if the itching persists, or even worsens after 7 days, don't ignore it. It's a clear sign that the cause isn't in the skin, but rather in the immune system. In this case, it's best to see an oncologist or hematologist. Esteban underwent the necessary tests and was diagnosed with early-stage lymphoma. The good news? When detected early, this type of cancer has a cure rate of nearly 90%. Today, he's doing well, receiving the appropriate treatment, and leading a normal life, grateful that he didn't let this itch go unnoticed. I want you to remember this. If you experience persistent itching on your lower legs, especially at night, and creams don't help, don't think it's just age. Your body is trying to warn you. Listening to this message could save your life. Now, let's move on to risk zone number 2, the middle of the back. Many older adults who experience persistent itching in this area immediately think it's a muscle problem, poor posture, or even the bedding. But that's not always the case. There's a very special connection between the pancreas and the nerves in your back. When your pancreas starts to malfunction, one of the first signs may be that persistent itch in the middle of your back. The pancreas sits deep in the abdomen, but it has nerve connections that extend to the back of your body. When the organ begins to show signs of trouble, whether from inflammation or a developing tumor, these symptoms manifest themselves on the back as discomfort, diffuse pain, or in many cases, localized itching. Interestingly, the skin in this area usually appears perfectly normal, no lesions, redness, or marks, but the itching sensation is intense, as if something is irritating it from the inside out. I remember Mrs. Carmen well, a 68-year-old woman who came to my office quite desperate. She had tried everything. First, she changed her mattress, thinking that was the problem. Then she changed her pillows and blankets, and even gave her home a thorough dust mite cleanse. Nothing worked. The itching remained in exactly the same spot on her back. She saw dermatologists, tried creams and home treatments, but nothing worked. The itching always started every afternoon, after dinner, as if someone had flipped a switch. This detail was fundamental for me. When a symptom appears repeatedly right after meals, we need to think about the organs of the digestive system. In her case, the pancreas. Whenever she ate something heavy, especially fatty foods, the back pain worsened. It was her body crying out for attention. If you experience something similar, there's a simple test you can do at home. Gently press the itchy area with your fingertips. If, in addition to the itching, you feel a kind of heaviness or internal discomfort, this is a sign that shouldn't be ignored. Also pay attention to your digestion. If after fatty meals you notice heartburn, bloating, or irregular bowel movements along with an itchy back, it's time to see a doctor. In Ms. Carmen's case, after more detailed examinations, we discovered early-stage pancreatic cancer. Thanks to her persistence in seeking answers beyond the obvious, she was able to begin treatment in time. Most people would probably have continued to assume it was a muscle problem or a mattress problem, and that would have cost her precious time. I want to give you a heads up. If your skin is normal, but you have a fixed spot in the middle of your back that itches every day, and the discomfort worsens after meals, don't ignore it. It could be your pancreas' way of warning you that something is wrong. Early detection makes all the difference between a long, quality life or a disease discovered too late. Now, let's move on to risk zone number 3, the scalp. Many people think an itchy scalp is caused by shampoo, dandruff, or dryness. But when this itching is persistent and occurs in specific areas, like behind the ears or on the back of the neck, without any signs of flaking or redness, it's important to consider something more serious. One of the first signs of leukemia can appear just like this. Leukemia is a blood cancer characterized by an overproduction of white blood cells. These cells, when accumulated, release inflammatory substances that irritate the sensitive nerves in the scalp. The most impressive thing is that, on the outside, the skin looks normal. There are no scabs, lesions, or dandruff, just that constant and insistent urge to scratch, which doesn't go away with anything. One case that really struck me was that of Mr. Ravier, a 73-year-old man who was extremely careful about his health. He told me that for 3 months, he wrote down everything in a diary, every time he felt that annoying itch. At first, he thought it was the shampoo, so he switched to a milder one. When that didn't help, he stopped using conditioner. Then he tried mild soap and even washed his hair every other day to avoid any irritation. But nothing helped. The strangest thing was that he had no dandruff, redness, or anything visible. Just that itching behind his ears and on the back of his neck, which drove him crazy, especially at night. This nocturnal pattern is very common. During the day, with the body moving and circulation working, the itching subsides. But when he lies down, when blood circulation changes, inflammatory substances accumulate and the discomfort intensifies. It's as if the symptom chooses the moment of rest to appear. There's a simple way to check this at home. Gently place your hand on the itchiest area of your scalp. If it feels slightly warmer than the rest of your head, it could be a sign of internal inflammation. It's not a definitive test, but it's a warning sign that warrants medical attention. Furthermore, the itching associated with leukemia rarely occurs alone. It often appears alongside constant fatigue, small wounds that take a long time to heal, easy bruising, or bleeding gums when brushing teeth. These signs, combined with persistent itching behind the ears or on the back of the neck, create a condition that shouldn't be ignored. Mr. Ravier finally agreed to do the blood tests, and that's when we confirmed the leukemia, fortunately, in its early stages, and that made all the difference in the treatment. So, be aware. If your scalp is very itchy, especially in these areas, and you've tried changing hygiene products without success, don't ignore the warning sign. It could be a silent warning of a blood problem, which, if detected early, is treatable and has a good chance of being controlled. Now, let's move on to risk zone number 4, the chest. This is a sensitive topic because many people think breast cancer only appears as a palpable lump, but there's a type called inflammatory breast cancer that can begin with something seemingly harmless, a persistent itch on one side of the breast, near the nipple or under the breast. This symptom, which many mistake for irritation from clothing, can be the first sign of an aggressive disease. What distinguishes this type of cancer is that the skin begins to change in a very characteristic way. It becomes red, thick, loses elasticity, and takes on a texture that doctors call orange peel. Often no nodules appear, which makes it even more difficult to detect. I remember Isabel, a 69-year-old patient who came to the office after months of struggling with an itch in her right breast. She tried everything, switching bras for cotton, silk, or bamboo, and even going braless for weeks to see if friction was the problem. But the discomfort remained in exactly the same spot. What caught my attention in Isabel's case was that her left breast was completely normal. This asymmetry was what alerted me. When I examined her, I noticed subtle redness and slight swelling near the nipple. The skin texture was different, rougher, something beyond the usual irritation. I requested detailed tests, and the diagnosis came clearly: early-stage inflammatory breast cancer. This type of cancer is dangerous because it progresses quickly. Unlike other breast tumors, it doesn't always form a lump that's easy to spot. Therefore, many women only discover it too late. The good news is that when detected early, effective treatments can make all the difference. And here's an important piece of information. Men can also develop breast cancer. Although rare, it represents about 1% of cases. Men over 60 are at risk, and because they don't wait, they usually go to the doctor when the disease is already advanced. If a man notices persistent itching around his nipples, or changes in the color and texture of his chest skin, he should seek help immediately. So, whether you're a woman or a man, the rule is clear. If only one side of your breast has constant itching, redness, or skin changes, don't ignore it. It could be inflammatory, aggressive breast cancer, but it can be controlled when detected early. The key is to listen to your body and act quickly. Now, let's move on to risk zone number 5, the genitals and anus. This is a sensitive topic, as many people are embarrassed to talk about symptoms in this area. But it's crucial to pay attention. As persistent itching, there could be much more than just irritation or hemorrhoids. One example I'll never forget is Mr. Ricardo, a 76-year-old man who's lived with hemorrhoids for decades. He thought the new itch he was experiencing was just another episode of that old problem. He used ointments, took sitz baths, and even underwent surgery to treat his hemorrhoids. But the itch didn't go away. What caught my attention was that this time, the discomfort didn't just appear when defecating or sitting, but it haunted me even while I was resting, silently, during the night. This persistence was what set off my alarm bells. Hemorrhoids usually cause pain or discomfort that varies, but here the itching was constant and localized, as if something was bothering him from within. Neither traditional treatments nor surgery brought relief. We then decided to further examine him, and discovered that the problem wasn't a hemorrhoid outbreak. It was early-stage cancer. Ricardo also began noticing other worrying signs: small amounts of bleeding during bowel movements, changes in stool consistency, and discomfort when urinating. These symptoms can't be ignored. They're a clear warning that this isn't something benign. If you or someone you know experiences persistent itching in this area, especially when accompanied by other symptoms, it's time to see a doctor. Early detection can make all the difference. In women, it's also common for itching to be accompanied by abnormal discharge, changes in odor, or changes in the color of vaginal secretion. All of these signs, combined with persistent itching, should trigger an important warning sign. It's understandable that many older people feel embarrassed or uncomfortable talking about these symptoms, but this delay can be very costly to their health. Cancer in this area, when detected in its early stages, has much better treatment options and a more favorable prognosis. On the other hand, delaying a checkup can cause the disease to progress silently, reducing the chances of a cure. I want to leave a clear and direct message. If itching in the anogenital region doesn't improve with conventional treatments, if it remains in a fixed location and worsens at night, don't ignore it. And don't let shame or fear be an obstacle to seeking medical help. Talking to a specialist early can be the difference between early detection and a much more difficult battle. Remember, your health should always come first. Now, let's move on to risk zone number 6, the hands and feet. This is perhaps one of the most underestimated symptoms, because we often associate itching in these areas with allergies, dryness, or the use of harsh soaps. However, when the itching is concentrated exclusively on the palms of the hands or soles of the feet and worsens at night, it could be a sign of something much more serious, an internal disorder that requires attention. A striking case was that of Alberto, a 70-year-old man who came to the doctor convinced he had nothing more than common eczema. The itching was limited to the palms of his hands, and he even joked that it might be a housewife's problem, since he spent much of his life washing dishes. He tried moisturizing creams several times a day, used gentle soaps, and even started wearing cotton gloves at night to protect his skin. Nothing helped. As I examined his hands, I noticed something subtle that had gone unnoticed, a slight yellowish tinge to his palms, and the lines in his skin were deeper and more pronounced than usual. There were no rashes, sores, or cracks, just an unbearable itch that woke him up in the middle of the night. This detail was crucial, because itching caused by internal problems is often accompanied by these very subtle changes in the skin, which are not related to allergies or dryness. The scientific explanation is clear. Some types of cancer produce toxins that circulate in the blood and stimulate peripheral nerves in the extremities, generating a localized itching sensation, especially in the fingers, palms, and soles of the feet. This symptom tends to worsen at night, when circulation changes during rest. The biggest danger is that many people, and even some doctors, associate this itching with diabetes, circulation problems, or common dermatitis, and prescribe topical treatments that don't resolve the problem. This false sense of security can delay a crucial diagnosis. In Alberto's case, tests revealed that the itching was linked to a serious internal problem that required urgent treatment. The lack of response to creams and basic care was the clearest sign that it wasn't a superficial condition. Therefore, if you are over 60 and notice persistent itching in your hands or feet, especially at night, and also notice changes in skin tone or lines on your palms, don't hesitate. See a doctor for an evaluation. Sometimes, that persistent itch seems like just a passing nuisance, something easily resolved with a cream or basic care. But when it persists, even after attempted treatment, it's much more worthwhile to investigate carefully and rule out something more serious, like cancer, early on. Paying attention to these signs can be the difference between peace of mind and facing a silent disease that advances unnoticed. So far, we've discussed 6 areas of the body where itching can be a significant warning sign, but I know you might still have questions. How do you know if that itch is just a common irritation, or if it's time to see a real doctor? So I want to share with you 5 simple steps you can take at home. They're not a substitute for a doctor's appointment, but they're a practical guide to understanding when the problem could be more serious. The first step is the 3-week test. Often, allergies or irritations disappear within a few days. If you treat the area and feel better within a week or 2, it's a sign that it was something benign. But if the itching persists for more than 3 weeks, be alert. This time frame is an indication that something deeper may be going on. To help, mark on your calendar when the discomfort started and see if it goes beyond that limit. The The second step is the lotion test. Use a moisturizer or anti-itch ointment 2 to 3 times a day for at least 7 days. If the itching improves, great. The problem is probably skin-related. Now, if there's no improvement, or worse, if the itching worsens, it's time to suspect the cause is within the body and seek medical help. The third step is to watch for symptoms that appear alongside the itching. Unexpected weight loss, unusual fatigue, a constant fever, or night sweats are signs that, when combined with the discomfort, require immediate attention. The fourth step is to observe the pattern of the itching. What time of day is it worse? Internal itching tends to intensify at night, when the body is resting and circulation changes. Furthermore, if the itching always occurs in the same spot, this is also a warning sign, because allergies or irritations often move around. And finally, the fifth step, consider your family history. If someone in your family has had cancer, your risk may be higher. In this case, if the itching appears in one of the areas we mentioned earlier, don't put it off. Genetics is an important clue worth taking seriously. These steps aren't meant to scare you, but to give you tools to better listen to your body. It's always trying to talk to us. We just need to learn to listen. In short, we've seen 6 areas where itching can be a sign we can't ignore. The first is the lower legs, where itching that appears at night may be related to lymphoma. The second area that deserves attention is the mid-back. When itching appears there, it could be a sign that the pancreas is crying out for help, something many people don't realize. The third area is the scalp, especially behind the ears and at the nape of the neck. This persistent itching, without visible signs on the skin, may be linked to early cases of leukemia. Next, we have the breast. Both women and men need to be vigilant, because inflammatory breast cancer can begin with just a dull itch, often dismissed as clothing irritation or an allergy. The fifth area is the anogenital region, where the discomfort is often confused with hemorrhoids or other common inflammations, but in some cases, it can be a warning sign of early-stage cancer. Last but not least are the palms of the hands and soles of the feet. Constant itching in these areas, which doesn't go away with hydration or simple care, may be linked to toxins released by tumors within the body. We also share 5 simple steps for self-assessment at home and better understand your body. First, the 3-week test. If the itching lasts longer than that, don't let it go unnoticed. Second, the lotion test. Use creams for a week and see if it improves. If not, keep an eye on it. Third, observe whether there are other symptoms, such as weight loss, fatigue, or fever. Fourth, pay attention to the itching pattern. If it appears consistently at night and in the same place, it warrants attention. And fifth, check your family history. If close relatives have had cancer, your risk increases, so don't hesitate to seek medical help. I want to make it clear that not every itch is cancer. Far from it. But many tumors begin with subtle signs, which we may end up ignoring. The key is to pay close attention, noting when the itch started, how it progresses, and whether it's accompanied by other symptoms. And most importantly, if the itching doesn't improve, don't put it off. See a doctor right away. If you found this information helpful, share it with loved ones, subscribe to receive more content, and show your support. This way, more people can learn to recognize these life-saving signs. Your health is your most precious asset. Listen to your body, take care of yourself today, and build a more peaceful tomorrow, knowing you've done the best for yourself.